Imagine a world where the lights slowly begin to dim, where cherished memories fade, and where the simplest movements become a struggle. This is the reality for children and families affected by Batten disease, a rare and devastating neurological disorder. In this video, we'll delve into the complexities of Batten disease, exploring its causes, symptoms, and the ongoing quest for effective treatments. Batten disease, at its core, is a genetic disorder. It's primarily caused by mutations in genes that code for lysosomal enzymes. Lysosomes are like the recycling centers within our cells, responsible for breaking down and removing waste products. These mutations lead to a deficiency in specific enzymes, disrupting the normal breakdown process. So, what happens when those cellular recycling centers malfunction? In Batten disease, the faulty enzymes cause a buildup of substances called lipopigments within the brain, nerve cells, and other tissues. These lipopigments, primarily a fatty substance called ceroid lipofuscin, accumulate over time, essentially poisoning the cells and disrupting their normal function. This progressive accumulation leads to cell damage, neuronal death, and ultimately, the neurological decline characteristic of Batten disease. Batten disease is a rare condition. It's estimated to affect roughly 2 to 4 out of every 100,000 births worldwide. Because it's an autosomal recessive disorder, both parents must carry a copy of the mutated gene for their child to inherit the disease. While Batten disease can occur in any population, certain types are more prevalent in specific geographic regions or ethnic groups, reflecting founder effects, instances where a specific mutation became more common due to chance within a smaller population. The signs and symptoms of Batten disease can vary depending on the specific type and age of onset, but some common hallmarks include vision loss, seizures, and cognitive decline. Many children initially experience subtle changes in personality, behavior, or motor skills. Vision loss often presents as progressive blurring or difficulty seeing at night. Seizures can take various forms, from brief staring spells to more severe convulsions. Over time, individuals with Batten disease experience a gradual loss of motor skills, speech, and cognitive abilities, leading to significant disabilities. Diagnosing Batten disease often involves a combination of clinical evaluation, neurological examination, and specialized testing. Doctors will carefully assess the patient's symptoms, medical history, and family history. Eye examinations, including electroretinography, can help detect retinal abnormalities characteristic of certain forms of Batten disease. Blood and urine tests can screen for the presence of specific enzyme deficiencies or abnormal lipopigment levels. Genetic testing plays a crucial role in confirming the diagnosis by identifying the specific gene mutations responsible for the disease. In some cases, a brain biopsy may be necessary to examine brain tissue under a microscope and identify the accumulation of lipopigments. Batten disease isn't a single entity, it's a group of related disorders classified by the age of onset and the specific gene affected. Some of the major types include infantile Batten disease, or CLN1 disease, which typically presents in infancy, late infantile Batten disease, or CLN2 disease, emerging between ages 2 and 4, juvenile Batten disease, or CL3 disease, the most common form, starting between ages 5 and 10, and adult-onset Batten disease, also known as Cuff's disease, a rarer form with a later onset. Each type is associated with mutations in different genes, leading to variations in the severity and progression of the disease. Currently, there's no cure for Batten disease, and treatment focuses on managing symptoms and improving the quality of life for affected individuals. Anti-seizure medications are used to control seizures. Physical and occupational therapy can help maintain motor skills and independence for as long as possible. Speech therapy can assist with communication challenges. Supportive care, including nutritional support and respiratory management, is crucial. Enzyme replacement therapy is available for CLN2 disease, offering a way to slow disease progression by replacing the deficient enzyme. Gene therapy is also being investigated as a potential treatment strategy. Since Batten disease is a genetic disorder, there's no way to prevent it directly. However, genetic counseling and carrier testing are crucial for couples with a family history of Batten disease, or those who are concerned about their risk. Carrier testing can determine whether individuals carry a copy of a mutated gene associated with Batten disease. If both parents are carriers, there's a 25% chance with each pregnancy that their child will inherit Batten disease. Preimplantation genetic diagnosis, a PGD, is an option for couples undergoing in vitro fertilization, allowing them to select embryos that are not affected by the disease. The prognosis for individuals with Batten disease is generally poor. The disease is progressive, and the rate of decline varies depending on the specific type. Most children with Batten disease experience significant disabilities and have a shortened lifespan. However, ongoing research is offering hope for improved treatments and outcomes. Gene therapy holds tremendous promise as a potential cure by correcting the underlying genetic defect. Researchers are also exploring other therapeutic strategies, such as small molecule drugs to reduce lipopigment accumulation and stem cell therapy to replace damaged cells. Clinical trials are underway, offering opportunities for patients to participate in the development of new therapies. The dedication of researchers, clinicians, and patient advocacy groups is driving progress towards a brighter future for those affected by Batten disease.